Acute lymphoblastic leukemia. What is ALL? ALL is a type of cancer that is found in the bloodstream and limits the body's ability to fight off infection. Symptoms include fatigue, weight loss, easily bruised skin, and frequent infections. However, in some cases, symptoms may not be present. There are 3 different types of treatments: induction, consolidation, and maintenance therapy. Induction therapy is when the therapy kills the cells in the blood and bone marrow to introduce remission, which is when the signs and symptoms have disappeared but the cancer can still be hiding in the body. Induction therapy includes chemotherapy, which is the use of chemical drugs to kill off cancerous cells. This treatment plan usually lasts 4 weeks and is done in the hospital. Another type of therapy is consolidation therapy. This is when any leukemia cells that are present but do not show up during scans or tests. At this stage, stem cell transplant is an option. A stem cell transplant is when diseased bone marrow is replaced with healthy bone marrow. This stage also includes preventive treatment to help prevent the spreading to the brain and other parts of the body. This stage of treatment can take several months, however, it is not necessary for the patient to be in the hospital. The third stage is maintenance therapy. This is when any leukemia cells are prevented by low doses of chemotherapy. The chemotherapy can be given with pills daily or once a month IV treatment. This is a picture of normal blood compared to leukemia. As you can see, the cells within the leukemia blood picture have multiplied twice as fast as the normal blood. Patient M. Patient M presented with fatigue and weight loss. She is a 10-year-old female. Parents brought the child in for admit via the pediatrician's orders. After testing, blood work showed signs of abnormality and concern. After further testing, the diagnosis of ALL was made. Their subcategories of development are physical, cognitive, emotional, and social. Patient M is in Piaget's concrete operational stage. Concrete operational is when the child is able to think logically, empathize with others, and understand time, volume, and weight. In order to understand this, let's watch this video. As shown in the video, the child was able to understand that despite whatever size container the orange juice was in, it was still the same. Same with the crackers. Moving on to patient M. Patient M visited the play area and met a patient with stitches. Patient M came back to her room afterwards and discussed with the child life specialist how she felt sad for the patient with stitches, therefore showing cognitive development. By feeling empathy towards the child with the stitches, patient M demonstrated her ability to fall into the cognitive correct stage. Patient M was able to follow directions given to her by the child life specialist and their mother. Patient M was following directions on a color chart. In order to accomplish the color chart, the directions were very complicated. By listening to the child life specialist and her mother, she was able to complete the activity. In doing so, this demonstrates that the child was able to follow directions, placing her in Piaget's concrete operational stage. Physical development. At this age, control over small and large muscles is present. Better hand control allows for more legible handwriting. Gross and fine motor skills more developed. Gross skills include running, jumping, and balance. Fine includes painting, writing, and coloring. Girls are typically taller, heavier, and stronger than boys during this stage. Patient M shows normal signs of physical development. At this age, the child should be able to control large and small muscle groups and better handwriting technique as a result of fine motor development. According to her chart, patient M is underweight, but this could be a result of her disease. Patient M is also able to color within the lines of the color by number activity. We will discuss the color activity later on. Patient was able to walk to the playroom, which demonstrated her balance and control over muscles. Emotional and social development. At this age, according to Erik Erikson, the child is in the fourth stage of development known as industry versus inferiority. At this stage, the child yearns for peer acceptance, needs encouragement to build esteem, and the child wants to continuously practice, learn, and be motivated. Patient M discussed how her friends might react. Patient M discussed with the child life specialist her fear of her friends no longer liking her because her hair is falling out. Patient described her desire to practice her gymnastics once she was better because her mother says she's so good. This shows the positive attachment of the mother and how the mother encourages the child to build esteem. The child also expressed concerns of body manipulation. She also discussed her friends at school, which allowed the child life specialist and I to view the peer interaction. Stressors in family. Patient M has never been admitted into the hospital, which creates a new environment for her. The loud noises and the constant in and out of the room are big stressors for this age. The diagnosis and prognosis are major events that impact the patient and the family. Below, you will see a chart with the percent of children and parents with significant traumatic stress after medical events. As you can see, cancer is one of the leading traumatic events. However, parents need to understand that by them displaying anxiety, it rubs off on the children. Ultimately, this is the goal of the child life specialist to provide a safe, secure, stress-free environment. This is possible because of patient M's family. The family is involved, and the mother and father are both present. Patient M has no siblings. Mother is a stay-at-home and does not work and is present during all hours of her daughter's treatments. Father leaves for work daily, but returns at the end of the day. Child life objectives. Create a stress-free environment by explaining medical procedures. Patient shows stress when doctor or nurse enters the room. Explain the treatment of chemotherapy and how it is going to help the child feel better. Child expressed concerns about IV and the idea of a needle being in her arm. Answer any questions the patient has pertaining to the hospital, staff, or treatment. In patient's M case, she was developmentally on track within all stages of development. Due to this, the child life specialist was able to assess and then plan for intervention. After assessment, the child life specialist noted that the patient M had fears of treatment, became tense when doctors entered the room, and felt anxious over the future of her disease. In patient M, the first process of intervention for child life is to demonstrate the insertion of an IV to inform the patient that the IV is not a needle. Using the cognitive development of the child life specialist used words that fit within the age range. Example, the IV tube was referred to as a straw that looks like one from a cup. The next intervention was promoting medical play on the patient's Barbie. The child took the blood pressure and drew blood. This helped her become aware of what was happening with her body. Socially, the child life specialist knew the child would respond to her friends, which would be Barbie or a stuffed animal. In any case of leukemia, child life interventions can include art activities, journaling, demonstration of the blood and cancer cells. For family-based interventions of leukemia, group time, family activities such as board games, coloring or drawing to express inner emotions. The arts and crafts benefit inner emotion, encourage self-expression, beneficial to allow patients to focus on another task instead of the diagnosis. This is not limited to just patient M. This is child life specialist as a whole. Journaling. As you'll see in the video coming up, journaling is a way for a child to express themselves. It allows the child a way to communicate their emotions to paper instead of expressing them to a grown-up. This encourages the child to express their fears and anxieties. However, this is for the cognitive development stage of being able to express one's emotions and having the gross fine motor skills to write on the paper. Hands-on demonstration allows the child to interact with child life specialists to learn more about their disease. This also includes medical play. However, in this case, the child life specialist chose to use jelly beans in water. This was developmentally appropriate for a 10-year-old because of the explanation of the cells multiplying. The patient was able to understand the multiplication of the cells because of the Piaget's theory. Concrete operational. It's also important for the parent interventions. In this case, the parents are overly involved and have a positive attachment. However, in some cases, this may not be the case. Child life specialists have to take into account the amount of care and the amount of time that parents are able to spend with the children. One of the best ways for child life to intervene with families is group time. This allows the family to bond and share how they feel about the current diagnosis. It also encourages interaction between family and patient. Child life specialist is present to help lead discussion and observe for future intervention techniques the family may need. Games or crafts. This allows the patient to do something fun with their parent. It helps take the patient's mind off the current hospital setting. In some cases, it helps restore a routine like the one at home. In patient M's case, her mother expressed that when she came home from school, she liked to do color by number. In order to accomplish some sense of routine away from home, the child life specialist gave her color by number and they participated together. This allowed the mom to have a little bit of freedom while the child helped restore a routine. Let's watch this video to understand a little bit theory to practice, and then we'll go into depth about it and how it relates to patient M. After watching the video, it was evident to see the overall role of a child life specialist. A child life specialist has the main objective of providing developmentally appropriate activities and interventions. In the video, the child enjoyed journaling and music. Knowing the connection of cognitive development and emotional development, the child life specialist in the video chose to incorporate both. The overall outcome was allowing the child to express herself in a way that benefited her the most. The child life specialist chose journaling because it was cognitively appropriate due to the child being able to write and understand concepts. In Patience M case, the child life specialist used her assessment to promote the correct activities that would accomplish the objectives of making the hospital less scary and educating the patient on the medical procedures. The child life specialist chose to use color by number after speaking with the patient's mother. The patient's mother expressed that on a normal day, patient M would come home from school and they would color together. The child life specialist incorporated this into her intervention plan because it provides developmental work and helps regain some resemblance to a routine. The color by number benefits physical development by practicing fine motor skills, promotes cognitive development because it is using numbers and having to logically commute them, and emotional social development benefits because the activity is being done with someone that promotes positivity. This concludes the presentation on child life specialist as a whole and patient M's progress throughout the time of observation. Patient M is still in the hospital receiving treatment. However, her child life specialist has a great bond and they continue to grow together. For more information on any of the information in this presentation, you can view any of the links down on the bottom of the corner of the slide.